Switching over now to health news, while the COVID virus and other associated variants continue to be a major issue in some countries globally, the problem here in the Bahamas has nowhere reached that level. Health officials say they're doing all they can to contain the numbers of those infected as they continue to relay the message that COVID-19 virus is still with us. Carla Palmer has this update.
As China continues to grapple with high COVID numbers, prompting some international countries to reintroduce restrictive measures against passengers traveling from China, the COVID numbers here at home continue to be relatively low. Minister of Health and Wellness, the Honorable Dr. Michael Darville, maintains he and his team have no concerns for now, but they're still closely monitoring the situation.
First of all, COVID has never gone away. And as you can see what's going on around the world, every country is seeing a slight spike in cases. There's no difference in the Commonwealth of the Bahamas. We do not have a direct flight from China to the Commonwealth of the Bahamas. And most people who come from China, they have intermediary stops. Those particular stops, there's some protocols in place. So there was no urgency for us from our EOC to implement any testing in our country. With that being said, it's a very fluid situation. We're monitoring it. And if we feel that there's a need to increase or extensify the protocols, we'll do so. At this point, no need to do it.
According to Managing Director of the Public Hospitals Authority, Aubanet Roll, there are just under 20 persons hospitalized with the COVID virus.
So the exact numbers I don't have today, but we were ranging just underneath 18. However, I think what's most important is that out of those cases, that's not the primary diagnosis still. So they're coming in with other medical illnesses, but as a result of our testing, that is a requirement for admission, but it's under control. We have moved those in isolated spaces that we call cohorted spaces so that there is control.
The legacy unit is open. That's the purpose for it being there. If we do find cases with mild to moderate symptoms, we have to have a facility to treat them. But the cases are very much manageable here at the Princess Margaret Hospital and the Rand Memorial Hospital.
With infrastructural work ongoing at PMH, health officials say very soon the modular units, specific for any infectious disease, will be in country, installed and operational. For the Bahamas Tonight, I'm Carla Palmer.